about fat grafting before and afters, because I have seen so many misleading before and afters from fat grafting lately. It is making my head spin. So with this surgery, you really need to evaluate afters at least 6 months out, and if you do high volume grafting, probably a year. So the process for this surgery involves taking fat by liposuction and placing it into the breast. Once it's placed in the breast, it needs to establish a blood supply so it can live and thrive. Fat that does not get that blood supply will not make it, and then your body should, in a perfect situation, absorb it. Now, if it doesn't efficiently absorb it, you'll get large areas or chunks of fat that didn't make it. This is called fat necrosis, and sometimes they even turn into oil-filled cysts called oil cysts. So when surgeons do fat grafting, I've done videos about this before, they usually do tight or loose grafting. So tight grafting is going to be lower volume, but a higher percentage of it is actual fat cells. And loose grafting is when they put fat cells along with fluid and other stuff. That's loose grafting. So typically lower volume grafting is more tight grafting, and you're going to get better take from that. Whereas loose grafting is higher volume and your take will be worse. But what I mean by better or worse is you get maybe 80% or more take with tight grafting, and then sometimes as low as 40-50% with loose grafting. So if you have significant grafting done, it can take a really long time for the fat that doesn't make it to be reabsorbed. And this doesn't happen in 1 month or 2 months or even 3 months. With high volume grafting, it can be 6 months to a year or sometimes even more. I've seen several patients in my practice recently who are well over a year out that were grafted elsewhere that have very large areas of fat necrosis, and it was never absorbed. So for these reasons, when you post as a surgeon fat grafting before and afters, they need to be long-term before and afters to really show whether the fat took or not. You just can't tell early on. And so here's some of the things that you can look at as a patient to determine whether these are early or appropriate fat grafting afters. So one of the first things you can look at is the skin. Is the skin shiny? So skin that is swollen and holding on to a lot of fluid appears shiny in photographs. And so if you look at the befores and afters and there's a lot of light reflection on the after, it's often an early after. The next thing you want to look at is dressings and incisions. So if the patient has incisions, what do they look like? And are there dressings still on them? So if there's dressings or steri strips still on incisions after fat grafting, it's almost certainly less than a month out. That should really not be shown as an after. The next thing is bruising. So look at bruising. Where are they in their healing? If they have purple bruises, they're probably within the first 2 weeks or so. If their bruises are yellow or green, they're probably 3 to 6 weeks out. That's still an early after and should not be shown. And then finally, what does the shape of the breast look like? Is the breast a flat, small breast before and a giant round breast after? Guys, that is not something that's achievable by 1 round of fat grafting, period. There's no magical surgeon out there that can do it. It's just not achievable. So if they're showing you a photo with a very small breast and the shape is very flat or even ptotic where it's a bit droopy and then all of a sudden it's very puffed out and it looks like an implant, that is an early after where the patient was overgrafted, and that shouldn't be shown. So these things shouldn't be shown because it's misleading to patients. As surgeons, we want you to know what it looks like when you have a surgery, and showing a patient an early result that is not their ultimate result doesn't do that. It deceives you. It convinces women to have procedures maybe they wouldn't have because they think that's the final result, when the reality is great, but it's not that.